Good afternoon, everybody. Welcome to our January 20th, 2022 video update. We'd like to first start off by saying thank you for tuning in with us. We really appreciate it. We're broadcasting from the new health center at the Pasco Yaqui Tribal Health Services Division. It's Thursday and we are working a vaccination event today. So please come on down if you have the opportunity. We'll be here until 5:30. Giving first, second, and booster COVID vaccines to everyone that needs one. First thing I'd like to touch on is the January 13th workforce reduction for essential services. Now, we went into that mode because of the high concentration of Omicron positivity throughout the community and throughout the workforce. But that doesn't mean that the tribe is closed. If you still need services from one of our departments, please don't hesitate to call here in New Pascua and in Guadalupe. The next item I'd like to mention is that we're still running our vaccination events or vaccination pods from 2 p.m. till 5:30 p.m. every Thursday. But that's always subject to change, so please keep an eye out on our website and look at the flyers just in case times change or location changes. Same thing for our testing. We're still at the Albert V. Garcia Auditorium from 8:30 to 11:30 in the morning. Then they break up to wrap up the testing that comes in after 11:30, and then they have lunch, and then they start back up again at 1, and from 1 to 4:30 they'll be testing. So please stop on by if you need a test. One other item, if you test positive and you need some additional services, please call the CRT hotline 520-879-5708, and then the call taker will ask you what kind of services you need. If you need a food box delivered, an isolation kit delivered, whatever you think that you need, you can ask them for, and we'll try to provide those services. But please be patient with us. We've had a huge increase in the volume of calls because of the positives in the community, but we will get back to you. The last thing I want to touch on is everybody please remember with this surge that we still need to remember to wear our masks, social distance if possible, continue all the hand sanitation measures, and limit your group gatherings. If you don't need to be with a large group of people, then please try not to be with a large group of people. And if you are, we would hope that you would all be vaccinated within that group of people, whether it's your family or your work environment. So Dr. Renteria is going to also share some information with you. And again, thank you for tuning in with us.
Buenas tardes, good afternoon. This is Dr. Renteria. A couple of comments on COVID. The Omicron variant obviously is here. It's the majority now. It's hitting us really hard right now. We're not exactly sure if it's peaked yet. It still may not have reached its peak, so we have to be very careful. So it's still a major threat. What I wanted to let folks know is that also because of this particular surge, we're having to be very careful with our supplies for testing. We do not have an unlimited supply. And what I want to let you know is that if you were exposed to someone that was positive and you think you need to be tested, with Omicron specifically, if it was a casual type of contact, you don't need to test until at least day 7. So there's no need to test on day 1, 2, 3, 4, 5, and 6. If it was a family member that was positive or you think we're exposed to, you don't need to test till day 10. So no testing on day 1 through 9. Those all tests could be negative and it doesn't do you any good. And also we'll be wasting supplies that we need to have. So please bear that in mind when you decide when to test. As Andre said, the most important thing you can do throughout this whole thing is wear your mask. The definition of exposure is being next to someone that's positive, not wearing your mask for more than 50 minutes and less than 6 feet. You have to meet those 3 criteria. The chance of becoming positive is pretty high. But if you're wearing your mask, the chance goes down to a very low chance. So just wear your mask for sure all the time when you're in public. And if someone comes to visit you at home, that's not a person that's there all the time, I would wear your mask as much as possible. The only other thing I want to bring up is there's some new Cdc guidelines that have been put out last week regarding people that are immunocompromised. And who are those folks? Those are folks that have certain specific conditions, so people that are being treated actively for cancer, someone that's had an organ transplant like a kidney, someone who's had a stem cell transplant like for leukemia and lymphoma, people with something called severe primary immunodeficiency. Basically, if you have that, you would know it. If you don't recognize that, then you probably don't have that. Anybody with a history or issue with HIV, and anybody getting treatment with high dose steroids for specific diseases. If you fall into those categories, the CDC has recommended that for the primary boosters, meaning Moderna, Pfizer, you should get 3 now instead of 2. So if you've gotten 2 Pfizer, 2 Moderna, and you have not gotten your booster, the recommendation now is that in those categories, you come in at least 1 month from the last dose you had, your second dose of those 2, and get a 3rd dose. And then as far as boosters, for these folks also, once you've gotten your 3rd dose, the booster is 5 months after Moderna or Pfizer. There is no second dose or no 3rd dose for Johnson & Johnson, but the booster is 2 months after you've gotten your Johnson & Johnson, also these folks in this category. So if you fall into that, make sure you come back. If you have any questions like that, you can still call our nursing department and they'll remind you. And then I think the next time we get on this, I'll go over this again because I know it's a lot of information. But the most important thing is hang in there, wear your mask, social distance as much as possible, and as Andre says, keep your social distance as small as possible because right now we're in the middle of the tsunami wave. Thank you for listening.
Thank you.